Last week, ACVREP published their final criteria for occupational therapists who want to become specialized in working with visually impaired adults. Here's exactly what you need to know and how I see it impacting our profession. Welcome back to our channel, the Society of Exceptional Educators. In this video, I'm going to walk through the exact document that ACVREP, the Academy for Certification for the Rehabilitation and Education of Blind and Visually Impaired Professionals, ACVREP, a lot of words, put out in regards to their occupational therapy line of accreditation. As you may know, if you are an orientation and mobility specialist, ACVREP has been working for the past few years to bring in occupational therapists to our line of accredited professionals who can work with people with visual impairments outside of like classroom teacher, TVI world. And what actually happened is that a lot of people got really scared and a lot of people had a lot of fears around what this could mean and what the OTs are going to take from us. And I have to say that all of those fears and all of those thoughts are really valid. However, we're still moving forward. And so as we look at this document, the question that I want you to ask is not just what do I think and how do I feel and what are my fears? But, okay, this is happening now. How can I help the OTs to do a better job? And what skills do I need as a vision education professional to be able to share and role release the things that these OTs are going to need from me so that, yeah, there is going to be overlap, but how can we do so in a way that actually increases the amount of support and direct service time that people with visual impairments get? If we can stay focused on that, right, then I think we have a much better chance of using this activity and using this new line of profession as a springboard for orientation and mobility specialists. Whatever happened in the past happened, and we don't have to go back to that. So let's dive in real quick to what we see in the Occupational Therapist Certified Adult Vision Rehabilitation documents. They have first and foremost changed the lettering. It looked a lot like the LTVR certification before, and now it's OTCAVR. So say that 3 times fast. I think we get more acronyms in our profession than probably any other profession. We rack those things up. But anyway, it's the Occupational Therapist Certified in Adult Vision Rehabilitation. So for those of us who are concerned about it moving into children, this is not happening just yet. We're going to scroll down, and excuse my scroll, it is 56 pages long. I went ahead and read it all. It's not a hard read, so go ahead and read it yourself. I will drop the link in the description below. It'll be a link to our Google Drive, but you can get it from ACVREP. So first and foremost, they go into the scope of practice, right? And they're talking about the designation for occupational therapists who has pursued additional education training and experience in the field of vision rehabilitation, enabling them to work with adults with neurological vision deficits, which we know is a very growing field. It is an epidemic at this moment in time. Low vision ranging from mild to profound, and blindness. So one thing that is buried in here is what occupational therapy is. We won't have to go through this part. We all do evaluation, intervention, and targeted outcomes. And so for evaluation, we're looking at what can they evaluate and what will their evaluations consist of. And it looks like we've got occupational history, performance patterns, client factors, physical, cognitive, psychological, visual, and psychosocial function. And then we also have some other things here in relation to their other medical reports. When we're looking at the analysis of occupational performance, it looks all pretty typical considering the context in which occupations are performed. We also, somewhere in here, talk about comorbidities as well. And I think that that's really important to note. As part of the evaluation process, this is where things get interesting. It is to determine the impact of vision impairment and or blindness on the individual's occupational performance. That's not something that an O&M can do. Only OTs can do it. And this line of accreditation is allowing them to be able to have an understanding of what the vision rehabilitation professionals already know, or our vision education professionals already know, and bring it into the world of OT. So they're going to assess all the normal things, available medical and visual history, including comprehensive visual evaluation, non-diagnostic functioning assessment and screening of the following visual functions, and you can go ahead and read those. Relevant areas, task analysis, a client's ability to use current prescribed recommended optical devices, electronic and non-optical devices, and compensatory strategies. This is a good place for us to support them if we're able to even work with them in that manner. And I say we as an orientation and mobility specialists, and them as the, I can't even say the word, OTCAVR, the OTs. Anyway, as we go down, we've got things where it does actually overlap, right? We knew that this was going to happen. Pre-driving and community mobility knowledge, access, and skills. And so I believe what Kathy has done here is showed us exactly where OTs were already doing this. So it's already in their playbook. Same thing with functional mobility, right? So they're going to assess the use of these things. When we look at the intervention, what are they going to be doing? What are OTs going to be responsible for? Well, everything that we would want them to be. The establishment, remediation, and restoration of a skill or ability that has not yet developed, is impaired, or is in decline. Compensation. We've got retention and enhancement of skills, promotion of health and wellness, including mental health, and the use of self-management strategies, and then mitigation of barriers for performance. We're also looking at occupations and activities, interventions that support occupations, education and training. This is another interesting part. What will they be training on? And that goes into more detail later on in the document, but this is a good read that you'll want to take into consideration. This is on page 9. We've got educating the adult client, how to increase the functional implications of their diagnosis and conditions and the impact on occupational performance. We've also got educating the clients about the benefits of additional services, Braille, orientation and mobility, diabetes, training in self-care, home management, health management, and strategies and techniques for using assistive devices. And then training in assistive devices and techniques to enhance functional mobility, including mobility aids. And then they do go on to specifically say that OTs cannot specifically teach cane skills, that they can reinforce them. Later on in the document, it also suggests that OTs have the competency to know when to refer a client out to an orientation and mobility specialist. And I'll talk a little bit about my thoughts about that as we go down. So as you can see, we've got visual skills training in sensory substitution, enhancement strategies to compensate for vision loss, so compensatory skills, more compensatory visual strategies, in the use of modification of environments, lighting and whatnot, advocacy, and then targeting of outcomes. Okay, so let's keep scrolling. We're going into the body of knowledge now. So the foundational knowledge that they'll need to have about the visual system and aging and disease and trauma. They also need to know the relationship between different etiologies of visual impairment or blindness and their impact on adult development in life transitions, behaviors, and environmental needs, and all the relevant theories and models of practices. Here's where we get into application of foundational knowledge. And I like how they define what OT is. I wish it had been further up at the top, but that is what that is. We've got different components of occupational performance here. Occupational analysis to identify demands of occupations and activities in the client. They assess the quality of client performance. And then, gonna excuse my scroll, assess and measure client factors impacting performance skills and performance patterns. I scrolled through some, but this is also a good part for you to take into consideration here. We've got page 19. The results of intervention, the overarching intervention principles related to improving occupational performance in adults with visual impairment and blindness. And we've got all of these things that our OTs, our new OTs in the VI field will be working on. And it's all the same stuff that we've already talked about. We want to continuously analyze and modify goals and interventions based on client performance, choosing interventions specific to their needs, educating and training in the use of strategies for visual sensitivity. And we're also looking at principles of optics and optical devices. This is for our adults with low vision. So our occupational therapists are going to be able to continuously analyze and modify the dynamic interaction between client factors and task-appropriate device selection. I think that's really interesting as well. And the OTs will be working on visual efficiency. And then we get into assistive technology, which is really big, especially in the OT world, and then writing and reading interventions for people with visual impairments as it relates to their occupational performance. Occupational therapists have always been working on daily living skills, so we're not even going to really worry about that. What I want to look at is environmental and task modification to improve occupational performance. So when we look at that here, it says implement techniques designed to optimize ambient and task lighting, reduce sources of glare, add contrast, minimize visual clutter in the home, work, and community environments. All the same things that we've been talking about before are all reiterated here again. They're going to be helping our clients to be able to modify their environment and access their environment safely. Okay, let's keep going. Section 4 is the professional practice standards. These are the basic standards for all of our ACVREP professions, and that is found on page 26. So I'll have you go take a look at that. These really just list out the things, the standards that they will be following. And then next we'll go into the competency checklist. As you can see, they're following the same structure as the other professions that we have within ACVREP. We've got screening, assessment, and evaluation. These are going to be the things that the OT will be assessing or evaluating on, and it's separated out by the type of visual impairment here. And then as we go down, we've got intervention. Some things that I thought were interesting just to pull out were that they are going to demonstrate the ability to educate and train in compensatory and non-visual strategies to address visual field deficits, adaptation using non-optical strategies, so cognitive substitution techniques, organizational methods. We have a lot of occupational therapy terms here as well. I didn't understand what this meant, the ability to apply visual skills training 3J, but I bet it's somewhere in the document. And so they're going to be working on all of these skills, and these don't look like they've changed very much from their original document. Demonstrate the ability to identify and educate clients and caregivers on the stages of adjustment of visual impairment and blindness as related to models of grief and loss and its impact on the rehabilitation process. I think actually kudos for this one, because it's so hard and it really impacts teaching, especially on an individual level. And then it goes into competencies for working with adults with neurological visual impairments, and then the intervention of that, and competencies working with adults with profound visual impairments or blindness. And so they have a whole list of things. And these are the areas that the orientation and mobility specialist would typically be the one to teach. In this case, if there's no orientation and mobility specialist, the OT will be teaching it. And then I believe if an orientation and mobility specialist gets on to the caseload, then they would work together. But you also want to make sure that you know that OTs will be demonstrating knowledge of the physical, sensory, cognitive, and emotional skills required to effectively navigate indoor and outdoor obstacles using a white cane, guide dog, or GPS technology to compensate for visual impairment and make referrals to orientation and mobility specialists. That's a really big one. And then the skills required to effectively use screen reader software, that goes back to our AT. And we've got our professional standards as well. Okay, so then we go into the code of ethics, which is typical for ACVREP and for many other accrediting bodies. We don't have to go through this. Let's skip down to the next section. Here's a principle that I really liked. They will provide they will promote organizational and business practices that benefit clients and society. Pretty cool. Okay, let's keep going. Principle 5, they will demonstrate integrity in their relationships with clients, colleagues, and other professionals. They can't accept monetary gifts. We all know that. They will provide accurate and objective information when representing the profession to other stakeholders. So there's a lot of working together principles here. I will continue to develop their expertise through lifelong learning and refinement of knowledge, skills, attitudes, and professional behaviors. Okay, let's skip down to the very last part. This is the big one. We used to have 4 different categories, and now there are just 2. There used to be multiple avenues towards this accreditation, and now we're looking at just 2. Either they have a graduate degree or they have self-study and they are working towards this accreditation. So what we see here, and let me move my face a little bit, is the formal low vision rehabilitation education from a university graduate level degree certificate program. So you can see that they will have 3,000 hours of experience within the past 5 years as an OT working with adults. And they have a 350 internship hours. There's 210 direct service hours and 140 indirect service hours. Now, when you go down into self-study, then you have to have proof of at least a bachelor's degree in occupational therapy, and then 3,000 hours of experience again, and another 350 internship hours requirement with 220 direct service hours. It goes up by 10, and 130 indirect service hours. It went down by 10 indirect. All right, you guys. So then it goes into the recertification criteria, and I don't really think that we need to go into that just yet. It's just your normal recertification criteria that orientation and mobility specialists go through as well with the different categories, and they line up pretty well. Again, here are my actual thoughts as somebody who has always been for this, because I don't believe as a principle of how I run my life in reacting from fear. I think that when we react from fear and we get all up in our heads about scarcity and this is going to go wrong and that's going to go wrong, then it leads to more things going wrong. Kind of like when you buy a red car and then all of a sudden you're driving down the road and you see a bunch of red cars. Our brains only have the ability to process so much information. And if we choose to have it process the bad information, we're just going to continue to see bad things. If we choose to have it process good information, then we train our brains to think, okay, this could be good, even if it doesn't feel that way right now. I think this is a really great way for people with visual impairments who would not necessarily have access to an O&M to get the skills that they need and to get the treatment, the occupational therapy treatment that they need in the way that actually suits them. Here are a few things that I'm thinking of just scenarios that could happen. If you've ever been in a hospital and you have failed your walk test, meaning you had to get up and physically try to walk and you were not able to do so, you understand how debilitating moments like that can be. And if you need an occupational therapist to support your tasks in that manner, and not necessarily walking because that would be PT, but any tasks in which you've lost some sort of ability to move your body or to function, and you're in a hospital where orientation and mobility services are not there to begin with, and you only have the option of occupational therapists who have no idea how your vision is going to impact the way that you do things, that puts you at a detriment for your own healing and for your own safety and performance ultimately. And so what I think is that in these moments, this professional accreditation is super great. I also think that it's really wonderful as any profession to be able to have avenues to level up. And so what I'm looking at is how can we help support our OTs? How can we help to role release? How can we help to make sure that they get the blindfold training that they need? How can we make sure that this line of professionals that will be coming up actually serve our learners and our clients in the best way possible? And is it that we empower our university personnel to pair up with their OT counterparts at the universities and co-teach? Or maybe it's that orientation and mobility specialists ourselves, we develop specific trainings to help support these OTs. There are so many different ways that we can actually rise up, and we can work with OTs and we can work with the OT profession to actually use one another to further our goals. Don't forget, as orientation and mobility specialists, we do not have the ability to bill Medicaid, and we want that ability, and they have it. So what can we learn from them? And how can we actually take those steps moving forward to work together? That's just an example of how I'm thinking about all of this. I want all people with visual impairments to have the skills that they need. And my ego does not say that I have to be the person, the only one person to do this. Mostly my ego says that because I'm already strapped for time. It's summer and I still have a bunch of stuff to do. During the school year, I don't have the time to take on more clients. And if I did, that would be super great, but I would be pulling my hair out and I wouldn't be a great mom to my kids and I wouldn't be able to do the other things that I want to do. So maybe we can look at it that way. Now, if you're an occupational therapist and you're looking at joining this profession, I think this is a really great way for you to level up your skills. And if you want more support with how to work with people with visual impairments, subscribe to our channel, join the society. It's a completely free membership, and we will help you and we will give you the skills that you need to take it from like book work to actual real world applications. We're here to help you. We're here to support you. And we want you and we want to work together on this journey. All right, that's it for me today. I hope you guys have a great rest of your day, and I will see you next week as we take a step forward to becoming better educators and caregivers for our people with visual impairments.